The evolution of how we treat skin is completely different. Before, people thought more trauma, more downtime, better results. But that's not the case anymore. I built a clinic that was truly missing in aesthetics. I analyzed the 5 parts of the face: bone, muscle, skin, fat, fascia, and then I utilize treatments that have very little trauma to the skin, but max results. Because healthy skin is resilient skin.
Tell me about the moment you knew AuraLux was something different.
Firstly, my patients' reactions. They were so excited to get a treatment that had little downtime, little pain, and the results were not just subtle, we're talking wow. And my clients were so excited. They were ready. They were like, when's the next one? I wanna do it tomorrow, I wanna do it next week. They were ready for that next zhuzh, that next refresh.
Most providers have been trained that in order for a laser to work, we have to have pain and downtime. What do you think about that?
Science has moved. AuraLux operates a 2910 cold fiber laser. First, you have to understand wavelength. 2910 nanometers is water's peak. As you know, our skin is largely water, so when you're putting that energy in, it's able to find exactly where it needs to go. You're not scattering heat into the surrounding tissues, so it's very precise. AuraLux uses an innovative fiber optic technology to create these micro beams. They're these tiny isolated columns of treated tissue with surrounding untouched skin. It's that surrounding tissue that wasn't touched that starts that healing response. AuraLux is so customizable and creates those different modes for different layers. 3D Miracle treats that stratum corneum, that outermost layer, a little deeper, you have Refresh, and then even deeper still into that upper dermis is Renew. That's where the collagen remodeling really takes place.
What's the conversation like when a patient's coming in for the first time for AuraLux? What are they concerned about?
Their top 2 things is pain and downtime. And with AuraLux, I can confidently tell my patient that their pain level is gonna be at most a 2 and very minimal downtime. And get this, no topical numbing is needed. Let that land for a second. When have you ever heard of that being possible? AuraLux has changed the game. The way I explain it to clients is AuraLux has this cool pulse technology. Most ablative lasers use a single beam. The cool pulse technology allows for the beam to be cut into 4 parts essentially. So you have this relaxation of the tissue between each pulse. I'm in Beverly Hills, no one can have downtime. We're talking Grammys, red carpet, it's never ending. I was able to customize it based on that person's lifestyle. So I could go downtime 1 to 2 days. I could customize it, go a little deeper, maybe like a week. And what I loved about it is it didn't impede that person's day-to-day life.
So the big question, what would you tell a colleague who is looking at AuraLux and is still maybe on the fence about bringing it into their office?
Swipe the credit card, just do it. People are so used to needing these aggressive, downtime, painful treatments in order to see a result. AuraLux doesn't do that. With that targeted, precise approach, you're able to see improvement of pigment, texture, fine lines, wrinkles, and they can still go back to their life. If you truly want to treat every single patient that walks through your door, it's AuraLux.
Lauren, thank you so much for talking with me today about AuraLux.
Thank you.